Good afternoon, everyone. You are very welcome to the HSE Health and Wellbeing Annual Report webinar. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using an iPad, you'll find this feature located at the top of your screen. Now, without further ado, I will hand you over to your host for today, Fergal Fox, Head of Stakeholder Engagement and Communications. Thank you.
Thank you, Jean, and welcome everybody to the webinar today. We're delighted to be able to launch our annual report via the webinar, and we hope that you'll be able to stay with us for the next hour, where we'll be giving you some insights and showcasing some pieces of our work from HSE Health and Wellbeing. As people would know, HSE Health and Wellbeing, we have a national team, and we have a number of regional teams. Our national team is made up of a couple of policy leads. You'll hear many of them today discuss the progress made under their area of work in 2024. And the now and the next. And we'll also hear from our regional colleagues in health and wellbeing and health promotion and improvement about their work on the ground delivering. So I just want to, I suppose, remind everybody that we're working under the Health Services Healthy Ireland Implementation Plan 2023 to 2027. That's our core document. And I think it's useful for us as we set out kind of on the reflection of today's webinar to look at the purpose statement of that plan. It says, we will promote and support healthy living and healthy behaviours for all age groups of our population and our staff as part of our core business in the delivery of health and social care services. So it really is a call to action for everybody in the HSE and all our partners to make health and wellbeing a mainstream service that's integrated everywhere possible. So many of our policy and activity areas will be highlighted today, but we just don't have time to touch on them all, and we don't have time to go very deep on a lot of the areas. So we'll showcase some videos, and we'll hear some from some of the colleagues working across the country in relation to health and wellbeing. First up, and to close it, we'll have Dr. Philip Crowley to officially launch the report, and he'll have some reflections at the very end of the webinar. First up, I want you to listen to our Assistant National Director of Health and Wellbeing, Helen Deely. So if we just play that, please.
Hello, everyone. I am delighted to welcome you to the Health and Wellbeing Annual Report webinar today. This annual report provides a synopsis of our work and the continued commitment of health and wellbeing and health promotion and improvement to promoting healthier living and supporting people in making lifestyle changes. As you all know, government policy provides the framework for HSE Health and Wellbeing's work and our policy priority areas. As we move towards health regions, it's important that we continue to implement actions from these government strategy documents in a standardised way across the country. This allows us to track and measure successful implementation. It gives us the evidence and data to inform future funding models and service delivery options, and it ensures a continued focus within the HSE on primary prevention, early action, and supporting people to manage their health. Tilda tells us that 74% of adults aged over 58 years have 2 or more chronic conditions. Health and wellbeing are focused on preventing the onset and progression of illness and helping people to manage and live well with their chronic conditions. And we do this in a number of ways. We support people to maintain a healthy weight through diet and exercise, to practice safer sex by distributing free condoms and home STI testing kits, to reduce alcohol dependence and alcohol harm. We deliver quit smoking services across the entire country. We deliver stress-reducing techniques like balancing stress, minding your well-being, social prescribing. We provide clear, accurate and accessible information to the public through our national media campaigns such as Quit, our websites and our podcast series. And by implementing education programs, we promote awareness and support lifestyle change through our Making Every Contact Count program, which is the HSE's key behaviour change program. By implementing MEC, we are supporting healthcare professionals to engage with and support their patients to take one small step towards changing a health behaviour which is negatively impacting on their lives. Health and wellbeing and health promotion and improvement will continue to drive the implementation of MEC across the entire health system and to seek opportunities to embed it in the new patient management system and integrate it with the HSE app. Targeting interventions for lower socioeconomic groups remains a key priority because the risk of multi-morbidity and mortality is greater in disadvantaged population groups, and this difference is widening. Evidence-based interventions focused on key population groups continue to gather at pace. Examples here include long-term care health communities, men's health, HIV prevention. And finally, strengthening collaboration with communities, volunteer groups and local partners is how we work best. Working with local authorities, local community groups in education settings and with other statutory and government bodies help us to build momentum and sustain what we do. Looking ahead, move to health region areas gives us a real opportunity to further integrate our services at local level. These changes will help us to respond more directly to local needs, to embed prevention messaging and work towards further reducing health inequalities. Most importantly, we want health and wellbeing to be seen as a shared responsibility across the entire health service and among our wider community partners. Finally, I want to thank our staff, local health promotion and improvement staff, and our local community partners. Your commitment and energy will enable us to continue to promote health and wellbeing as a key part of a fully integrated health service. Thank you and enjoy the webinar.
Thank you very much, Helen. And I want to echo one of our key points there at the end about recognising the health and wellbeing workforce, whether you work in the health service or one of our funded partners or non-funded partners. I suppose the reporting and the reflection on the work in 2024 and 2025 and as we go ahead is completely dependent on that workforce. So a lot of appreciation to everybody there. So we're going to go on now to talk a bit about our policy work, and we're going to have a chat with Dr. Aisling Sheehan and Martine Blake in 1 minute. But first I want to show a video with 3 little snippets of some of our work. First up, you're going to see Professor Alan Carr talking about the challenge of lifestyle change. Then you're going to hear a little bit about from Micheál Martin reflecting on the 20-year workplace smoking ban. And you're going to see then John Wall reflect on why he became an advocate for men's health. So play the video there, please.
So that when we say I'm embarking on a process of changing my lifestyle, that's a really tough thing to do. And we're much more likely to persist at it if we have a lot of wins. Okay. So we have to try and organise as many wins as possible on this journey. And a good way to win is to do small things, do small challenges that we know we can win at. So I think that would be the first place to start. So to accept that change is difficult, that we're involved in a process of lifestyle change, and to start with little things. And I think I mentioned in one of our earlier conversations that if we're depressed, we might say something like, I'm going to do one small thing today that I used to enjoy, but I'm not doing it anymore. And I think the one I mentioned was cycling. So I'm going to go for a 5-minute cycle today. And tomorrow I might do 7 minutes, but today it's only going to be 5 minutes. Or if I'm anxious, I might say, this anxiety is crippling my lifestyle. It's boxing me in. But I know if I practice my breathing or my relaxation or my meditation exercises, that I can bring my anxiety down. So I'm going to do one of those with one exercise each day. And I'm going to build that then up over time.
I think it's had a very significant impact on public health. I always say it was the first major public health debate we ever had in Ireland in the context of the issue of public health. This was smoking. And when we announced in January of 2023 that we were going to introduce a ban 12 months later, it meant that for the entirety of 2003 we had a debate. That was the first impact. But it's had a huge impact, I think, on heart disease, on lung disease, on ear, nose and throat conditions, particularly for bar workers and people in the hospitality sector, and in terms of stroke. And then in terms of the impact on lives, many people speak very positively about the absence of smoke in the workplace and in hospitality. And then for people with conditions like asthma, cystic fibrosis, I remember early on parents of children with those conditions saying, for the first time ever we can go to a hotel, for the first time ever we can go to a pub with our kids for a sandwich or whatever, which we couldn't have done before that.
I was inspired by others. At the time, I guess it was women that were talking about their health. It was women talking about their bodies. That's certainly what I saw. But they inspired me. People like Laura Brennan, people like Vicky Phelan, they inspired me, I suppose, to get up and deal with it, to do what I can to help others, to make sure that what happened to me, I was a combination of doesn't help or doesn't happen to others, and also if it does, that my lived experience can help those. And it's also very therapeutic for me, because it means that the diagnosis and what I went through counts in my mind for something, and it's not just something I went through, it's something that I've also learned from, and made me the person that I am today, and to live the life that I'm able to.
Okay, thanks very much. Just that piece at the end there, people may not be aware that John is, he was working through, he got diagnosed with stage 4 prostate cancer, and he became very active advocate for men's health. And he also participated in a podcast last year with Noreen Turley around patient partnership. So that's just a piece from the launch of our Healthy Ireland Men plan last year. Martina, can I invite yourself and Aisling up there now just to talk through some of those clips? Aisling, I might start with you. We heard from Professor Alan Carr, and I know that balance and stress program, we launched it this year, but all the legwork is probably done in 2024. Can you tell us a bit more about where that fits in?
Sure. Thanks so much, Fergal. It was great to see balancing stress highlighted there. So Balancing Stress was a partnership between HSE Health and Wellbeing and HSE Psychology, and also with our colleagues in the Spark Innovation Programme and HSE Communications. So we were delighted to launch that earlier this year. And as you said, a lot of the work was done in 2024 to design and film the video. So this was a key deliverable for us within our Stronger Together HSE Mental Health Promotion Plan. And it also then delivers on the new National Mental Health Promotion Plan that was led by the Department of Health, so Pathways to Wellbeing. That was launched at the end of 2024, and we were really delighted to work with colleagues in the Department of Health and with other colleagues to support the development of that plan. And I suppose going into the future, I think the rollout of and continued development of mental health promotion initiatives obviously is a key priority for us. Balancing stress was a key one in 2024, as well as social prescribing. And I know social prescribing will be featured a little bit later on in the webinar. But a key focus for us has been on building the evidence base for social prescribing. So we did do a number of key pieces of work with researchers during 2024 on that. 2024 also saw the rollout of an adapted version of our Minding Your Wellbeing programme with older people. And we were really pleased to partner with health promotion improvement colleagues around the country, working in partnership with Alone and Family Resource Centres to roll out an adapted version of that programme. And the University of Galway evaluated that and showed really positive findings. So a number of key initiatives were delivered on in 2024, and I suppose looking into the future, we're keen to develop those further and further deliver on our Stronger Together and our Pathways to Wellbeing policies.
And I know that you're also responsible for the area of alcohol, and this our Tuesday was FASD, International FASD Day, and I know this is a particular focus on it this month. So would you like to just give us a little insight into that work that you've been doing?
Sure. Yeah, I think really important to acknowledge FASD Awareness Month this month. And as part of our work around communications, alcohol and pregnancy is a key focus of ours. So in 2024, we conducted market research around alcohol and pregnancy. And I suppose some worrying figures coming out of that, in that 22% of the public believe that it's okay to drink alcohol during pregnancy. So that's something obviously we're really keen to change. We also conducted a literature review, and all of that work is now informing our current work around updating and improving our communications campaign with the public. I suppose some of our other pieces of work, Fergal, if I may, I know they're highlighted in the report, but a couple of other key highlights for 2024 for the alcohol programme was the start of the evaluation of our Know the Score programme in schools. So that's a piece of work that's being funded by the Department of Health, their Drug Prevention and Education Funding Scheme. And we also piloted an early intervention service for alcohol care in primary care. And that was working in partnership with Social Inclusion and Primary Care in North Dublin. So a number of key things got off the ground for us in 2024 that were
Yeah, and people will see, we'll share the link to the report at the very end there. There's way more detail around these programs, and as I said at the outset, we don't have time to go to touch on everything. But Martina, I thought it was very stark here in the then Taoiseach, the current Taoiseach, talk about the 20-year anniversary, which we celebrated in 2024, when he came out and supported that work. But like, we've come a long way. Like, it's amazing, isn't it?
Yeah, absolutely. I mean, we have certainly reduced smoking prevalence over the last, 20 years. And, we celebrated that anniversary in March of 2024. And very shortly afterwards, the minister announced the move to increase the age of sale to 21, and we'll be the first country in Europe and in the world to do that. There's a bit of a lead-in time in terms of it'll be 2028 before that comes into play, but that's another very welcome move in terms of tobacco control. But I suppose one concern that we do have is that while, that piece of legislation was groundbreaking back in 2004, and did, impact in terms of, encouraging people to think about the risk around secondhand smoke, the risk around smoking itself, and encourage people to quit. We still have a smoking prevalence of 17, 18%, and it's stalled since prior to COVID. So, 2019, and also there's a significant health inequalities gap that is there as a result of smoking. So we haven't managed to reduce smoking prevalence specifically among those who are most deprived and in most in need. In fact, their smoking prevalence is high, has grown between 2015 and 2022. And we've a study that we published last year indicating that, and that the gap is widening, and almost half of the health inequality and gap in life expectancy between those who are most affluent and those who are least affluent is purely down to smoking prevalence, which is really significant. So if we're interested,
I took part in a little piece of your tobacco symposium yesterday with your workforce around tobacco, and it was encouraging to see repeated efforts and kind of really consistent efforts to target different priority groups. So, and I know the same case for Aisling and all our other policy areas. When it comes to disadvantage, there's a clustering of poor health behaviours there, and tobacco is a really dangerous one. But you're taking an approach trying to address different priority groups.
Yeah, so one of the things that we did work on and launched, did a lot of the groundwork on last year in 2024, and it's continuing into this year and was launched in March of this year, is our financial incentive scheme. So this is where we are delivering a pilot initiative in 3 areas, Cabrafinglas, Longford, and in Limerick and Kilrush. And it's where we're introducing vouchers and financial incentive as part of the Stop Smoking service, and that is really working very well. We're getting feedback from clients that they're finding the service really, really good. I mean, a few teething problems in terms of administration, but that's what we're about in terms of learning around the pilot. But financial incentives, we know that financial incentives, where they have implemented those internationally, they work really well. We've also been working with our colleagues in the Irish Prison Service. We've gone into Wheatfield Prison and trained some of the Red Cross volunteers to become Stop Smoking advisors themselves, and to, support group work. And we managed to persuade the governor and persuade the powers that be within the Irish Prison Service to allow prisoners to access their phone to ring the quit line as well, because they had some restrictions around who they could phone and how much time they could spend on the phone. So that's been another win. And we're also working with social inclusion, and some of our Stop Smoking advisors are making inroads in terms of homeless services, and bringing people who are homeless into our stop smoking services, but also signposting them out to other, social prescribing, other types of services, trying to support them to access better housing and better care,
No, it's
and
very
alcohol treatment and all of those other areas. Yeah.
it's very it is very complex when you get in, because there's so many different needs displayed there with those groups. But I don't want to let you go without you touching on the work that you've been doing around vaping, and I know that you've been producing resources over the last year or more around e-cigarettes, and I know that we've had a couple of like webinars and podcasts where you've highlighted some of this information. But and I know that you're kind of working very deeply now on the development of a vaping campaign. Do you want to tell us a little bit about that?
That's right. Yeah. So, I mean, I suppose, since disposable vapes became kind of very popular and became on the market, I suppose from 2019, we've seen a huge explosion in the number of young people who are vaping and vaping to try it and vaping regularly. And among 15 to 24-year-olds, it was 1 in 5 young people. Now it's 1 in 3. And so there's a 20-fold increase in nicotine use actually among that age group and population in those years. So really concerning for us in terms of, we know that people who vape have are 5 times more likely to go on to smoke in later life, and that's a real risk. And obviously even nicotine addiction in and of itself has risks in terms of mood and impulse control, neural pathways in terms of other risk in terms of addiction. So, we're concerned about that. So we've developed resources in terms of SPHE resources, and we're about to launch the year 3 lesson plans around that. We've developed some out of school resources as well. And as you said, we're planning our new vaping and pouch use prevention campaign as well. So there's research underway in terms of, asking the target audience. There's 2 target audiences: young people themselves and parents and guardians. And there's some focus groups happening actually next week in plans and preparation for the development of that campaign, just trying to get the tone and all of that correct for launch later this year and into next year.
That in 2026 or late 2025.
Yes.
What else, as we just kind of close out this section, what are you looking forward to over the next year? Do you think that vaping and pouch, that's your big ticket item over the next 12 months?
Yeah, it will be. I mean, the department are also working on a new Tobacco Free Ireland government policy and strategy, and we're working with them on that. So that will kind of guide the next 10 years. Obviously, we haven't reached our goal of a smoking prevalence of 5% by the end of this year. So, we really need to kind of step up our game in terms of new thinking in terms of tobacco control policies. Like, why do we still allow, just retail to be as prolific as it is? We need to restrict the number of retailers we have, things like that. Denicotinization, which is a mouthful, is another policy that's being trialed internationally in terms of reducing the amount of nicotine within cigarettes to make them less addictive, and lots of other policies that are under consideration.
And Aisling, before we let you go there, what are you looking forward to over the next 12 months?
Thanks, Virgil. Yeah, there's lots of exciting things happening with both our mental health and wellbeing and our alcohol programs. I suppose a couple of new exciting things is the rollout of a new community-based mental health promotion initiative called Act, Belong, Commit. So we've just started a pilot of that in Meath, and we're really excited by that and its continued expansion into the future. And then on the alcohol side, I suppose as a key thing that we're working on with public health is around a needs assessment for the prevention of alcohol and drugs. And we're really excited about that and the potential for it to inform our work. And we're also just about to start a pilot of a new digital tool to support people to reduce their alcohol and drug use. So again, a lot of new exciting developments we're looking forward to.
Yeah. And while we won't be able to talk about it, Martina, we don't have time today, but the work that the tobacco program is doing with the HSE app,
That's right. Yeah, launched today, new quick plan.
I can just mention the digital solution that they're working on, and we talk about balancing stress as a kind of an online resource. So there's just so important, I suppose, in terms of getting to the scale that we need to address to have those digital footprints. I'm going to let you go there because we have to move on. Thanks very much.
Thank you
for your input today. And before I invite Sarah O'Brien up, I want to show another video. And the video is going to show first example of a campaign from Safe Food the hashtag Talk About Food campaign that we supported last year. Eamon Keogh did a great podcast about it, episode 69, if you're interested in this. So we'll hear from soundbite from Dr. Nora Campbell and Dr. Aileen McGloin. And then we have a short clip of a discussion panel from our Every Move Counts, the National Physical Activity Guidelines and Sedentary Behaviour Guidelines. We had a launch webinar earlier in the year, and Colin O'Hare from the Department of Health, he kind of speaks about the multi-stakeholder, or the need to have a multi-stakeholder involvement in initiatives such as this. So roll it there, please.
In order to make money, unhealthy food brands have to achieve the 4 golden hallmarks of success. The food has to be cheap. It's cheaper to buy strawberry flavoured sweets than it is to buy strawberries. The food has to be convenient. It has to be packaged in a way that allows on-the-go eating, in pouches, in bowls, in tubes. It has to be hyper-palatable, meaning really, really tasty, because that stimulates repeat consumption. And it has to be everywhere, on your phone, on the bus, on your television, everywhere. Unhealthy food brands are competing in a marketplace of emotions. This means that brands work really hard to be associated with particular emotions like happiness, fun, nostalgia, wackiness. This type of emotional branding is even more powerful than taste.
If you think about a typical day, here's the kind of thing that might happen. So we get in the car, we're heading to work. We pass a billboard that has an ad for an unhealthy food. Then we stop at the petrol station. We want to get something healthy for breakfast, but actually we can't even find the fruit bowl. But what's presented to us immediately is the smell of all those pastries that are so delicious. And you know what? There's an offer for an unhealthy food right in front of you when you walk in the door. Then you're getting your lunch later on in the day, and you go for a brown bread sandwich with lean meat and vegetables, as you should. But actually, there's an offer that means it's just as cheap to have a fizzy drink with that and a bag of crisps. And then when you're heading home in the evening and you want to buy your dinner, you go into the supermarket. Guess what? 35% of the offers in the supermarket are on unhealthy foods, and you're 16 times more likely to see an unhealthy food in a prominent place like the end of an aisle or at the tills than a healthy food. So even if we had intended to eat healthily at the beginning of the day, we can see how the food environment conspires against us to achieve that.
Yeah, I suppose this is where there's a role for all the different stakeholders in, and I think the guidelines are designed for a diverse range of stakeholders. There's a role in there for the messages that were developed for each stakeholder group. There's a responsibility on our education system, on our transport system, on our sports and facilities, on our local authorities. There's a responsibility on all of these sectors to promote physical activity and the benefits of it. And I suppose, the sedentary behaviour angle as well. I'd kind of see that as much as, with Healthy Ireland and the Department of Health, we'll do our utmost to raise awareness of what's in the guidelines, and we'll incorporate them into policy development. And through the physical activity implementation group, all of our stakeholders will incorporate them into their policies. But beyond that, there's a responsibility on all of those sectors to raise awareness of the importance of physical activity. I think there's a kind of a sea change role to this piece of a kind of embedding it into the daily routine of everyone in our society. And that calls on, there isn't one stakeholder that can crack this. And this is probably coming back to why it required that cross-sectoral approach and why the guidelines themselves are built for that.
Thank you. It's great to get those little got caught up. I've seen those videos before. Sarah, can I invite you on? Sarah's the lead for a Healthy Eating Elective Living program. So she's been very deeply engaged and driving work in that area for a good few years now. Sarah, can I first ask you to reflect, we had two very different, but kind of, the theme is partnership in terms of this section, but what's your thoughts? I know that Every Move Counts definitely was one of your big ticket items last year.
Oh yeah, absolutely. It was fantastic to get to have the guidelines launched. I was involved in the production and development of the first National Physical Activity Guidelines for Ireland back in 2009, which sounds like it. Well, it is. It doesn't just sound. It is decades ago. great. Those were produced by the health service itself. The new guidelines, the review and update was while we did the work, it was done with and on behalf of the Department of Health. So they are, you know, very definitely national physical activity guidelines, and while they're based on the World Health Organization guidelines, uniquely they include a suite of messages that Colin was talking about there that are designed to support people working in whether you're a healthcare professional, whether you're a social care professional, whether you're working in education, whether you're working in active transport, built environment, or local authorities, to help you understand the value and the importance of physical activity and promoting physical activity in your area of work, and to help you communicate that with your colleagues, and to you know, because what we need is champions in each of those sectors. We need those champions working from the inside.
Shared responsibility. I must say, looking at the imagery that was created around the launch, with all the different stakeholders kind of represented, from disability to children to older people, you know, that the Every Move Counts guidelines, and I know there's resources in development, but yeah, trying to, you know, tell the people and the different subgroups, the different priority groups, exactly what they need to know.
Absolutely. So the guidelines last year cover babies, children, teenagers, adults, older adults, and people living with disabilities. And I have to say a big thank you to colleagues working in Dublin Midlands and in who were able to reach out and get people from the community and from local schools and that to come and showcase, and also our friends in Waterford Local Sports Partnership who lent us a lot of the kit that we use. But this year in June, at a much more low-key way, we also have managed to publish guidelines for people living with chronic disease and for pregnant women, pregnant and postpartum women. So we'll be doing a lot of work to communicate those out. So we've, you know, a whole suite of guidelines for the population at large. And earlier this morning, I was with another group where we were looking at with the people who work on the COSI survey, the Growing Up in Ireland, the Health Behaviour in School Children, Healthy Ireland, the Irish Health Survey, looking at like, so what do we do? An Irish Sports Monitor, how do we now like take those guidelines and consistently measure our progress against those across the next decade or so. And we're very lucky to have Professor Tessa Strain over from the University of Edinburgh. She's an expert in this area, an epidemiologist, and she's a consultant to the World Health Organization around that. So, you know, like we are really so lucky with the academic partnerships we've had. So in developing the guidelines, the first set was Professor Elaine Murta from the University of Limerick that you've seen on the screen there. So she led that work, a really diverse team of national and international experts. The guidelines that we launched this June, Professor Michael Harrison down in Southeast Technical University led that work again with a large group of national and international experts as well. So, you know, we are so lucky with the partners and the breadth and depth of expertise that we can connect with here.
Can I point you back to the healthy food environment piece then? You know, that the two clips there, I thought, really showcase the challenge that we have. You know, and I know that's a massive concern. Like when you hear the different voices doing the analysis of the unhealthy food environment that we actually live in, that it really kind of hits home to me that we have to take such a kind of a planned approach to navigating the unhealthy food environment if we're going to be eating healthy food regularly.
Yeah, absolutely. And look, we've been working with Safe Food probably for the last 10, 15 years in the space of childhood obesity prevention campaigns and communications. So like the pivot to the food environment campaign was really deliberate. We would have spent about a 12-month period working with Safe Food and other stakeholders to shape that change, because I suppose the evidence is that no matter how much we support and educate people at an individual level, the environment we're in is conspiring against us and conspiring against our best efforts. So the purpose of the campaign is very much to raise awareness and improve understanding among the public, as well as those stakeholders who have a role in changing that food environment, of the impact that it has. And then behind the scenes we have so I suppose the TikToks and that show you the public facing part of the campaign, and behind the scenes we have a food environment forum and a food environment roadmap, which is kind of a cross-border multi-agency space, where we can kind of coordinate the work and the activity that all the various partners have the potential to do to start reshaping it. In terms of ourselves here in the health service, a lot of the work that we're leading on is represented in that roadmap. So we have our an advisory group that we reconvened there last year, refreshed and reconvened, and they're overseeing work to update the HSE vending policy, the calorie posting policy, and also to look at the research and the evidence around how we might use the concept of nudges to shape and reshape and change the food environment in the health services. We work with the Irish Heart Foundation to support our catering services to participate in the Happy Heart Healthy Eating at Work Award. And last year, 17 sites across the country received the Gold Award for that. So it's really brilliant to see that. We also kicked off work with looking at our schools training, and from next year we'll be rolling out a new training which will support teachers and schools to look at their food environment and to develop and implement policy that creates a healthier school food environment, because our children spend a significant part of their day as well as a significant part of their year in school, and up to a third of their daily intake will be in that environment. So really important to support that.
I just see somebody asking a question there around lifestyle behaviours and the challenge of us in terms of health and wellbeing, focusing on individual behaviours when the systems in the environment are so complex. And I know you're just literally talking about that in terms of the Talk About Food campaign and the work you're doing in the health service. But that systems approach to the healthy eating and the physical activity, like it's the same as Colin O'Hare is talking about, the multi-stakeholder. It's not just, it's making it realizable and achievable.
Absolutely. And like a really good example of that in practice is the work that's happening in the 19 or 20 Sloan-to-Care Health community areas through the community food and food poverty pillar. So we have our community food and nutrition workers there. They're working with their host organisations, with the health promotion and improvement staff, with the local authority staff, and other community partners to really look at what the local environment is, what the gaps in terms of strengths and the weaknesses are, and kind of engage in terms of what innovative responses can be put in place to address local needs. So it was amazing last November at the symposium, where we had posters from every single one of those areas talking about the different work that they're doing, and also really excellent presentations. And I suppose when you talk about local systems, local health systems, and that, it's on paper it can look simple, but in reality it can be quite complex. And when you looked at what went through all those posters last year, and at some level you could say, oh, this is really diverse, and how is it all connecting and adding up? But actually, when you take that whole systems lens and look at it, it does join up. And we're just working through a co-creation process at the moment with all those stakeholders to publish a measurement and outcome framework for that work, which really will help articulate that local systems approach and provide more further guidance that will allow and enable all those collaborations locally to happen, and allow us to kind of in time see impact.
Okay. In terms of over the next 12 months, I know you have a webinar coming up towards the end of the month. If you want to just flag that in relation every move counts. But just your last word, really, before I move on to the next section here. What are you looking forward to?
So one of our highlights of this year was we got to start work with the HSE digital team on our Get Active program in April this year. Yeah, and on the HSE app. We got to start that work in April this year. Been 2 years in the making, getting to there. So absolutely next year, one of the big ticket items for us is to get that out live into the public in use, version 1, learn how it's going and further enhance it. So that is a big ticket item, following hot on the heels of Quit, as Martina was saying, was launched today.
Okay, well, we'll stay tuned for further developments on that one. Thank you for your input there, Sarah, and I'll let you go now. So next up, we're going to look at the community sector here. And before I invite Jonita Murphy and Ellen O'Dea to join me, I want to show a short video that showcases the voice of the service user in terms of Sláinte Care Health Community's parenting program. We have you'll hear and see a mother talking about her experience, and then that moves quickly to a clip of one of our podcasts with the Family Resource Centre Forum talking about social prescribing and how they kind of utilize social prescribing through the network of family resource centres across the country. So if you can play that video there, please.
I am from Kildare but living in Athy. I have a almost 4-year-old daughter, Ella, and I did the Parents Plus course in Athy. In the mornings, our struggle would have been getting our daughter ready for school, getting out to work. So there was always stress and tension in our house in the mornings. So I had been told that the course was good, so I thought it's free, it's in the evenings, it suited me after work, and I looked forward to Tuesday evenings because the Parents Plus course was on. With the guidance and the advice from Selena and Victoria through my Parents Plus course, my daughter Ella has seen a massive change in both her mammy and her daddy, especially in the mornings. There's not as much rushing or stress with we're going to be late. We have much more of a structure, we have a routine, the house is calmer, but also basically she's more happier in herself. She's more confident in herself because I'm more confident in myself. We had our cup of tea, we have a WhatsApp group, we meet up, we go to the park. So we've even built up friendships out of it. I've already told everybody that I know who have children in that age bracket that it's the best thing that I did. And I just think it was amazing, the fact that it was free and in the town.
Social prescribing is another initiative through Sláinte Care Health Communities that you've supported in some places, and that's definitely well connected to your fundamental delivery of connecting people, isn't it, Shauna?
It is, yes. We partnered with Sláinte Care, I think in 2019 for the Integration Fund, and we piloted social prescribing in 10 sites. So subsequently then we partnered with Cork and Kerry Community Healthcare through the HSE, and we have 3 full-time equivalents in Cork and Kerry and 7 part-time social prescribers down there. The beauty of having social prescribing in an FRC is it's the opportunity for someone to come in and obviously to meet the link worker, to work through that, understanding what are their needs, looking at their strengths and working through the process of social prescribing. But it's so much more than that, because social prescribing in an FRC has the opportunity for people to avail of step down, so some group supports, but also then to actually for step-up supports, as I would call them. So there's the opportunity if someone is going through a really difficult time and they've worked through the social prescribing, but they actually need a little bit more support, there's the opportunity in FRCs to avail of counselling. So close to 100 of our FRCs around the country actually have a counselling service. This is available for young people, but also for adults as well. So the social prescribing can tap into the other opportunities in FRCs as well.
Okay, that's great. Can I invite Ellen and Jonita to join me there? Jonita Murphy is the Health Promotion Improvement Manager in HSE Dublin South East, and Ellen O'Dea is the Head of Service for Health and Wellbeing in the Integrated Health Areas of Dublin North County and Dublin North City and West. You're very welcome.
Thanks, Fergal.
So we just saw a clip there, or the first one up there was from the parent taking part in the parenting program as part of the Sláinte Care Health Communities. Sarah flagged it earlier on. We have it been delivered in 20 communities around the country. Ellen, can you give us some insight into the progress of the implementation of Sláinte Care Healthy Communities and in 2024 from your own perspective?
Yeah, I think, look, it's gone from strength to strength every year since it started in 2021, and we previously had a pilot in 2020. And definitely what we've seen is the level of engagement with the programs, whether it's Stop Smoking, We Can Quit, Healthy Food Made Easy, the parenting programs. There's been really good engagement with the programs, but also the feedback that we've had from our community partners, both in terms of the maybe unintended consequences, but really positive consequences where people attend something that's very low threshold, like a Healthy Food Made Easy program, but then suddenly realise that actually it's not as scary to go back into education or to get support from a family resource centre or community development program. So we've seen people move on to become both facilitators of programs, but also to move on to education and training and access other supports like the previous video spoke about. The other piece that I suppose we've noticed is the feedback from general practice particularly has been really, really positive in that they've really seen the impact on their patients, particularly with chronic disease, when it comes to the Stop Smoking services, the Healthy Food Made Easy, but also the social prescribing, particularly for people who are really at risk of mental health issues. And that has been a hugely positive piece for general practice within our areas, that the targeted areas that with across the country. So, really positive and going from strength to strength. And we're delighted to see it expanding this year to 4 new areas.
4 new areas, yeah. We'll come back to that in a second. Jonita, in terms of implementation in your area, how has that been? Would you echo what Ellen just said?
Oh, absolutely. I mean, it's an incredible success story, and not only is it the success because of the evidence-based programs that we're implementing in these areas, but it's also that partnership piece, working with our community partners who are our agents of change on the ground and very much representing our work and working in partnership with them. So our health promotion colleagues working in our area, like we have 9 partners leading out on those programs that we mentioned here, whether it's parenting, tobacco, social prescribing, Healthy Food Made Easy, and they're working very closely with families, individuals, communities on the ground, implementing it, and it is a wonderful success. But the success is because of the partnership. We need our community partners, and we need to work hand in hand with them, and that's the success.
We included the voice of the Family Resource Centre there for that purpose, but Family Resource Centres are the only active participant. There's lots of active agents. Ellen, in terms of what you just mentioned there, the 4 new areas. So we're last year, in terms of the funding that's been delivered under Sláinte Care Healthy Communities, we're literally expanding. So we're going from 20 to 24, and 2 of them are in your backyard.
Yes, yeah. Well, we've actually 3 in our region, two Dundalk and Drogheda and Blanchardstown, which is in the area that I currently cover, and then the other one in the Tala area. I suppose it's great to see the expansion, and Jonita mentioned community partners there. I suppose another partner that we would have in terms of statutory partners would be the county councils, and the local development officers are also a huge part of this. But also, as the healthy communities develop those other kind of partnerships that we've developed over the years, with the sports partnership, for example, that we have lovely examples in some of our areas where things like walking groups, support for things like walking groups locally within Sláinte Care Healthy Communities areas. So it's not just about the investment in the programs or the investment but the investment in the individuals, both the local development officers and the health promotion officers locally, has an additional outcome in terms of new and innovative approaches to bringing organisations together to deliver collaboratively around, whether it's physical activity, whether it's community events, whether it's HSE involvement.
That was a big innovation of this, wasn't it? Really, bringing that LDO, local development officer, in the local authority together with the HSE, and then resourcing, like the department. In fairness, like you said, they've given some innovation funding there. So, and I suppose Sarah O'Brien referenced it in terms of the community food and nutrition workers. But in terms of that LDO piece, been new isn't always, it's still a challenge. So
Yeah.
how has that been for you in terms of, what impact it's had?
Yeah, I think it's that one of the things that has really worked for us and has worked with both the LDOs and I think the healthy community leads within the county councils, or the Healthy Ireland leads, sorry, within the county councils, has been that broader comms and the ability to engage with people we may not always access. People don't generally come to HSE services until they need a service. Whereas actually we in health promotion, we're trying to get messaging out to the whole community. And even that kind of being able to access the comms links through the county councils, engage with broader groups of people, and just that engagement in terms of Healthy Ireland subcommittees or local committees of people coming together, whether it's a Healthy Communities kind of implementation group in an area where you have the local development officers, HSE health promotion officers, but also whether it's GPs or pharmacists or other, community development organisations all coming together collectively saying, well, what can we do within this area, working with the community to improve the health of this community? And that developed then a community of practice and a whole way of working that is better than any one organisation, but is a combined effort to improve the health of the local community with the local community.
Thanks very much. We're running a bit on time here, so I might just put it to Jonice in terms of looking forward to the next 12 months. Ellen has said we're going to have 4 new areas, hopefully see a lot more of that as they get their footprint on the ground over the next 6 months. But Jonice, from your point of view, what are you looking forward to over the next 12 months?
Oh, look, it's a continuation of that partnership, working with our partners in the communities across the whole 20 sites and in 4 new sites as well, building on that very strong basis. I mean, it's the partnership piece that is kernel to the success of the Sláinte Care communities. And then I suppose that peer-led initiative as well, because a lot of our community individuals and families that become involved in it, they themselves then go on to become peer leaders as well and become key facilitators, whether that's around the Week and Quit programme or that it might become healthy food Mid-Easy tutors. So it's that building the capacity from the ground up. So really excited, delighted to have the funding continually being resourced and look forward to further expansion into the future.
Okay, well, look, I'm sorry to rush you there at the end, but really appreciate your input and support through all the programmes and specifically this input today. Thank you very much, guys.
Thanks, Fergal.
We're going to move on quickly in terms of the integration theme. In the next video you see it's going to be 2 very different pieces. First piece is from the Making Every Contact Count programme in the Midwest and an example from the mental health services. And then the video is going to switch to something completely different, the You, Me and HIV campaign. So roll it there, please.
Teach na Beatha is a 7-bedded high support hostel in rehabilitation and recovery. The average age is mid-40s. Our residents all have an enduring mental illness as well, a challenge that they have to deal with. So MEC is an evidence-based framework in health promotion. So we kind of look at things like activity, diet, lifestyle choices and see if we can support people to make changes.
The MEC training consisted of online modules and an in-person training day as well, and it definitely helped build my own confidence in being able to deliver the MEC programme to our residents to implement it. Change in lifestyle, checking in with them more and assisting with them, going with them if they wanted to make changes in their life, whether it be physically, diet, alcohol use, cigarette use. We'd be there to help them along the way.
It absolutely is working, because with chronic disease management, here we've seen improvements with arthritis. We had a client who was taking medication 3 times a day. That's greatly reduced. And definitely in terms of exercise and the physical activity, she's found it's made a difference.
Teach na Beatha, they contacted Pat Sexton, who's our programme manager, and he asked me to come up here, that the group were up here doing walking. It's about building their confidence, their fitness levels, and it's something that they can feel proud of and basically achieve themselves.
She allows us to walk around a couple of times. She stops to do exercises every four pit stops, I found I'm much fitter now, since it started. It helps me balance.
I love it. It's good. It's really fresh to do it in the morning. You feel fresh, you feel energised, you feel healthier.
I suppose growing up as twins, I always found that whenever you were upset, I would be automatically upset.
Yeah.
It's like a little built-in best friend, you know?
You were the first person I told I was HIV positive.
I was just so concerned for your health. It was scary because we didn't really have a lot of information around it.
We grew up in the countryside, and I feel like in rural Ireland, maybe in Ireland in general, like no teenager is talking about their sex life. That's what made it the worst. It was like not knowing anything, because if we had known that being on effective treatment means that you can't pass on HIV, I think from the get-go you probably it wouldn't be less scary.
You can have HIV and you can still live a happy, great life.
I always say that HIV has changed my life, but not in the way you would think. I myself am lucky to be part of the Pos5 tribe, a group of people all living with HIV, showing that it's possible to not only be happy, healthy, but also to thrive.
I think it's important that our generation has someone like you who's going to step up and say, you know, I'm Adrian, this is my status. And I think you've probably helped a lot more people than you've even realised.
One of the reasons why I wanted to do nursing was that I could be the person on the other side of the desk helping a 17-year-old who doesn't know anything about what HIV is, and it's not the end of the world. It's not anything to be scared of.
Okay, two very powerful videos there, very different. I'd like to welcome Sandra Coughlin, our training and program design lead, and Orla McGowan, our sexual health lead, up on screen there, if you can join me. And I'll go to Sandra first. That MEC implementation piece, it's a lovely example of seeing it integrated into mental health services. What's your thoughts on that?
Absolutely, Fergal, and just thanks to the staff and residents of Chocknabaha for sharing their experience with us. I think it's really powerful to see the impact of MEC and what it's all about in terms of us supporting our patients and service users and taking those opportunities as part of our day-to-day routine care. And in 2024, we had a webinar around, and it was our first webinar around why chronic disease prevention works. And we had the benefit again of really showcasing examples of implementation in practice and just the diversity. I guess our theme for this section is integration, but we were demonstrating examples of MEC implementation in general practice, in a public health nursing team, in disability services, and then also in our acute services in a pre-surgical unit in Ennis Hospital. So again, we just were able to showcase how different services, different staff, with the support of the MEC leads that are working in the health promotion and improvement teams locally, with their support and with their leadership, that there's really strong implementation happening in our efforts to scale up MEC across the whole health service.
Okay, yeah, well said. And I know you're also responsible for the education program, and we might just pull up some of the flyers there and just give a little insight. I think this is often a hidden part of health and well-being that health promotion improvement are supporting you nationally on. Might just give a little insight into the work here.
Absolutely. And look, I'm delighted to showcase this because, again, my program of work is very much about working across our own health and wellbeing team, so that we're not, I suppose we cut over all of the topic areas. And one of the areas that we do this most significantly is in terms of our education program of work. And the training and resources we provide to teachers to support and promote wellbeing in their schools is one of the areas that we work very much across our health and wellbeing team. But we also have a really strong partnership with education colleagues. So the Department of Education, who provides substitution cover for the teachers to come and attend our training, but also the National Education Psychological Service and the National Council for Curriculum and Assessment. We've been working strongly together in partnership to develop all of the resources that are available on our website to support the new junior cycle SPHE specification. And now we're working on developing resources to support the senior cycle specification as well. So there's a huge partnership in terms of us working with the Department of Education and colleagues to support wellbeing and to support teachers to promote wellbeing with their students across primary and post-primary. And again, all of this training then is delivered in the regions by our health promotion improvement colleagues. So delivering training programs around physical activity, around healthy eating, around emotional well-being, and also delivering training to teachers around the skills for facilitating SPHE, because again, it's not just about the topics and the knowledge, it's about how that knowledge and information, how the teachers can really support that curriculum and support that evidence-based approach to learning in the classroom, and thereby creating a really supportive environment for all of the students and young people to reach their potential and to be able to meet the challenges that life faces us all, that they have the skills and coping strategies to deal with the challenges as they arise. So that's what it's about.
Yeah, that's you're saying a mouthful there, like, but it's great to see the Department of Education prioritising well-being, working in partnership with yourselves. And I know, Orla, you've many years been a champion of integrating into education and sexual health. Your program has been working closely with Sandra's program around some of these resources.
Hi, Fergal. Yes, and look,
take down the slide there now, Jean. Thanks, sir. Yeah, there we go.
Yes, we did an awful lot of work on the resources for schools in 2024, and it's great. Look, we now have relationships and sexuality education for first years, for second years, for third years. And this year now we're working on the 5th year resources, and that's again, as Sandra was saying, in partnership with the Department of Education and the NCCA, which is a really important partnership for us in relation to supporting schools and teachers to be able to teach good relationships and sexuality education. But it's important to say we're also working with the regions to build capacity to address relationships and sexuality education in the wider community. In 2024, there was 14 foundation program and sexual health promotions run. There was 192 participants from all around the country. And then there was also courses in sexual health policy and a new sexual health signposting course for people working with international protection applicants. So it's, sexual health promotion and education, it's important to say it doesn't just happen in schools, it happens in the home with parents, and happens in the wider community with youth workers and with people who are working.
It's great to have the support of partners in those realms to get you the reach and scope you need. And I know that like hopefully before we close the webinar, we'll hopefully show one of your videos around the whole STI home testing, which is targeting young people again. But tell me about the STI home testing service in particular, because I know you made some improvements last year in relation to that, and it's kind of going well.
Yes, look, we're coming up to the 3rd birthday of the STI home testing service. We're sending out 10,000 tests a month, and it has increased the numbers of people getting STI tests by about 33%, which we're delighted about, because a lot of the people that are using the service never previously tested for an STI, and it's really good that we were able to provide a service that people find accessible and easy to use. And then we did a pilot in 2023 and then into 2024 in relation to people who test positive for chlamydia. So the majority of people that are test positive through the service test positive for chlamydia, and they're now certain people that are eligible are able to get opted for a prescription to be sent directly to their local pharmacy by free of charge, which is just much more convenient for the patient. It means that it also reduces the numbers of referrals to clinics for treatment. And we have very strong links with the clinic. The clinical staff they've completed training on the SH24 platform, and they can update patient records as well as see patients' SH24 medical history and any interactions they've had with the SH24 team. So we're currently even working on further links with clinics. So for example, we're working with the HRB at the moment on a piece of research, and as part of that, we're looking at blended models of clinic visits for particular groups of patients, particularly
You're just
people
beginning to glitch on me there a little bit, Orla. So I'm going to ask you, your big ticket item this year, I suppose, was the sexual health strategy. But tell me, like, from your perspective, that's you obviously were involved in the development of that. What is it from your own perspective?
Well, there are it's a 10-year strategy, first of all, and there'll be 3 action plans. So there is a huge amount of work involved in the strategy. There's a goal around sexual health promotion and education, which is big for us. Then there's the sexual health services, sexual health research, and working in partnership. But I guess one of the main pieces is probably the development of the model of care for sexual health services. So work on that is going to has started this year, and we hope to have it at a fairly advanced stage this time next year. And our objective there is to ensure that people can get the care they need when they need it, in ways that are user friendly and achieve the desired result and are value for money.
And we showed a clip of the HIV campaign there, the stigma campaign, and I had the pleasure of interviewing Robbie and Veda around the original creative, and this creative that we showed there was more recent. You must be very proud of that with your campaign colleagues.
Yeah, look, it was a really successful campaign, and we're doing a lot of work this time last year with our colleagues in communications, Ein and Mira, in relation to that campaign and the development of it. And it was a very special piece of work, because we worked with people that were living with HIV, and they featured in the campaign people living with HIV with their family and with their friends. And the response to it has been really, really positive. More people living with HIV, such as Adrian in the video that we just saw there, came forward to be part of the campaign after that first wave. And what we were trying to do there is to communicate the message to people that once you're on effective treatment for HIV, you cannot pass it on to sexual partners. And our campaign evaluation of wave 1 showed a really significant improvement on the understanding of that message. And we're currently working on evaluating wave 2. But what's almost as important is that the response to the campaign in the HIV community has been very, very positive and very welcoming.
Okay, I'm going to have to leave it there now, because we're a little bit over time, but I really appreciate your inputs. We'll move it on though. Thanks very much for your input today, guys.
Thanks, Virgo.
So the next piece here now, I just want to welcome Dr. Philip Crowley up to officially launch the annual report and for his own reflections.
Thank you very much, Virgil. Yeah, what a wonderful webinar. A really powerful reflection, I think, of a phenomenal year's work by a really great team of people under the banner of Healthy Ireland. I kind of see this work as really important part of other work that I lead around sustainability. For example, the best form of healthcare is no healthcare at all. So if we can keep people healthy, we can save money, we can ease hardship, and we can ease the impact we have on the environment. And let's face it, healthcare is becoming unaffordable. I mean, if you look at the inexorable rise of our budget over the last 5-10 years, that will not be able to continue. And with the demographic challenge of an aging population, that's only going to become more challenging. And that brings what the work that you're describing here today more than ever into focus as a absolute priority for our health services. And I love the way that what was presented today, and what I know of the work throughout the number of years I've been involved, is we work on what works. The teams engage in reflective practice, so they evaluate what they're doing, and they learn from it, and they improve it. It's evidence-based and it's innovative. The example of the free NRT is a phenomenal success story, where we had to argue for an increased budget last year in order to ensure that we could meet the demand ever rising, which is a real success story. And the innovation then in terms of incentives, I'm sure that we're going to learn a lot from that. I love also the focus on equity, because let's face it, some of the hardships of health and healthcare are concentrated in poorer communities and communities who are more marginalized. And I love some of the specific work I've seen in prisons, with the homeless, mental health communities, and traveller community. My own clinic is in the homeless, and I've tried to use MEC in my own clinic, a very chaotic clinic, but one where you can use it. So if you can use it in that kind of environment, I think MEC is something that we should all be using. And I love, finally, I think the progressive nature of the work, the fact that it can be quite challenging to people's norms and assumptions. It can push back against reaction at times, and operate sometimes in contested spaces, but in an entirely evidence-based and justifiable position. And it's not easy work. It's not easy to change behavior. It's not easy when the commercial forces are driving behavior in the other direction. It's not easy to work when, let's be honest, like a lot of the work that I'm involved in, it's a little bit on the margins when you have a health service that's really focused on access, and justifiably so. People waiting on trolleys is a scourge. It's terrible for people, and it's an unsafe care. So that's a really massive focus for a health service. So getting the foot in the door for health and well-being is really important part of what you all do. And it's been quite successful because funding has increased, activities increased, and the behavioural diet is shifting, although we've noted in this webinar a couple of the challenges in that space. So really, I'd just like to thank the national team for a wonderful group of people, for a wonderful webinar, really well put together with some very powerful videos. I'd like to thank the great staff doing this work on the ground in the communities. I'm very proud of this annual report for any tiny role I may have played to support this wonderful programme of work. And I'm very happy to launch it today and commend it to everybody to read. Well done to everybody, and thank you.
Thank you very much, Philip. Really appreciate your support. And I suppose it goes without saying that leadership support is fundamental in terms of delivering on the strategy that I said at the outset, the Healthy Ireland Health Service Implementation Plan, where all this fits under. We've had some great support last year from yourself, Philip, across a number of events and webinars. And we had great support from Bernard, our CEO, as well. He came onto the podcast in February. He made a fantastic video for staff around World Mental Health Day, and he also turned up and spoke very passionately at the Traveller Creativity event we had in the Museum of Modern Art, which I know, Philip, you were at yourself. So look, we're going to close it there. We're slightly over time. Apologies around that. But we're going to leave you with this video that's just hot off the press around the home STI testing service that Orla was talking about. Thank you for participating today and coming along to the webinar, and thanks for your support for HSE Health and Wellbeing.